right there is the order right here, right? So you check out posture just like you do in standing, see your corresponds, right? Then we do range of motion, okay? And if you notice, I'm going in order, right? So just easier that way. So essentially, we're gonna check out posture. We're gonna do range of motion of the thoracic in a second, okay? Then we're gonna do hip and leg myotomes. Then we're going to do slump testing, reflex testing, and done. Okay? So, thoracic rotation. Checking rotation and thoracic mobility is absolutely crucial. A lot of people skip this step, so make sure you do this, right? Because we haven't been talking about the why, right? Like I said, pathoanatomical is not the most exciting thing, right? That's why I had Dr. Rush teach it. Yeah. But the thing is, right, if you have this lower back pain and you have a sprain, right, because the lower back is moving, right, remember, it's very simple. If you understand this concept, you know how to treat ortho patients, right? It's very simple, right? The guy that moves too much is in pain, right? Think about all diagnoses you've learned thus far, right? Shoulder impingement is because what? The humerus is moving what? Too far up or something, right? I don't know, pick any diagnosis, except for frozen shoulder, I'm going to trick you on, right? Is because something moves too much, okay? Meniscal injuries is because why? You're rotating too much. Patella injuries because the patella is moving too much in the wrong direction, okay? So regardless what the diagnosis is, it is very simple. If you're moving too much, it's because 99% of the time, something is moving too little somewhere else. Okay? So if somebody has pain, bending forward, okay, to the lower back, the question I always ask myself, hips, so hips here, right? Can the hips flex adequately? Can the lumbar spine flex? Because look at the spine over here again, okay? When you bend forward, we'll go over mechanics later. Everybody should be bending forward. All right? Beautiful. Okay? If you don't move here, what happens? That lumbar spine moves a whole lot more. Okay? So, one of my mentors is Earl Petman, who founded NIAMT. Right? He used to have a saying, right? We call this screaming victim silent culprit. Ha ha ha. I didn't laugh. That was more fun. Right? So, essentially, a lot of you guys were like, Dr. E, I don't get it. I felt like he had, my patient had anti-rotation on this side, but they had pain on this side. That makes sense because you're locked here and you try and move more here to compensate. Okay? So this is why when you're checking the lower back, you always have to check above and below. So this is why you must do thoracic range of motion checking. Make sense? Okay. So you guys know, you guys already learned this from Dr. Rush, right? So what did you guys learn? How do you guys check out range of motion to extension for thoracic spine? Huh? No, epiphyms, that's the each segment, right? I'll be here all day, right? I just need to know roughly what's the thoracic spine doing.
The spine is fine. This segment. Yep.
Right. How do I know the thoracic spine can extend and flex and side bend?
You have to lock it up.
Lock it up. So what do I do?
Arms up.
So, good. Do that. All right, and do what? Good. Actually, can you sit over face the side? No, face it. Good. Good. So when you're doing this over here, right? Relax, right? You're just checking out extension, right? But my hand makes a huge difference. If I put my hand over here, what am I doing? I'm checking upper thoracic. Dave's there. Okay. Middle. Lower. Okay. Make sense? Okay. Yeah. Hook underneath. All right.
Like this?
Yep. Do that. Right. Flexion. All right. But then when I'm doing this, I have to make sure what? I'm checking here, here, and here. So what's my other hand doing? Providing a fulcrum. So my hand is on his chest, right? That's why I haven't crossed his arms, because if it's female, inappropriate, right? So you cross your arms, it's okay. And then flex here, right there. And then flex well over here, and then flex there. Okay? Yeah. Are you feeling with your thumb in the inner spinal space? When
Mm-hmm.
you're
No,
in the
no.
back there?
I'll be here all day, right? Because 12 segments, right? So the whole goal is just to see roughly how's it moving. You're looking and you're feeling, right? And you're seeing. Okay? All looking and seeing the same thing. Aha. Go seeing them. Okay. All right. Then here in the back. Okay. All right. So then you check out your side bending. Same principle, right? Side bending. Right? See my hands here. Just checking out the three regions, right? Upper, middle, lower. This is just gross. Right? We're not doing the small rhythm assessments you guys learn, right? We just want to see, can they move, and is it affecting the lower back? Okay? Now, when you do this, what I really want you to do, it's the same principle, but you're looking at the lower back. Okay? So ready? Hand behind the back. In here, okay? I'm looking, look at that, right? He moves his lower back when I try to get upper. That tells you a lot. Okay? So let me use somebody else. Daniela, can you do this compare? And so you have a special upper graphic as well. You can sit right there. I can sit down. Sit over. Head right there. Right. Right. So when I'm doing this up here, right? See, that's nice, right? That's upper thoracic extending, right? All right. And I guess I shouldn't dare forget. So Dave, come over here again. So I can see it before now. No, change my mind. Just kidding. Behind the back. Okay. All right. When I try to bias over here, right? You see this here? I have a hard time comparison to Daniela, all right? And like, for me to do this, he moves his lower back. You see this is the hinging point. Okay. Thank you. Okay. I added the rest of the case, sorry. And then also, you check your rotation. When you do rotation, this is the whole entire spine. You can't bias one part of the spine. Well, you can, but this goes fast. Right? Yeah, you learned that one. All right, then you do your myotones, right? You know this one, right? Leg up, like this. Hold it for me. 1, 2, 3. Slip your hand underneath. Push up. Push up. 1, 2, 3. L3. Move your foot like this. Dorsiflex. Hold it. 1, 2, 3. Just your toe. All right. That's L5. 1, 2, 3. Let go. Push down. Let's check your hip extension. All right, which is S1, S2. 1, 2, 3. Don't let me pull your leg up. Hold it. 1, 2, 3. Okay. All right. So it's quick, fast, and efficient. Up like this. Hold it. 1, 2, 3. Relax here. Push up. 1, 2, 3. Bring your foot towards me. Hold it. 1, 2, 3. Just your toe. 1, 2, 3. Push down. Push down. 1, 2, 3. Go a little pull you up. 1, 2, 3. All right, just relax for me. Any pain here, and go straight to slump testing. Okay. All right. Push yourself. She's a nice slump testing. Okay. Do I have to review slump testing? You guys know this one, right? Okay. So that's slump testing. Okay. All right, and then relax here. Reflex. Reflex. All right. L3. Last one. All right. That should be a review. I went fast because I'm assuming you guys did that before. Okay. So let's practice this, but really practice the whole thoracic part. Okay.